Welcome to this informational video about comprehensive prevention planning in California, brought to you by Strategies Technical Assistance. Strategies TA is a project funded by the California Office of Child Abuse Prevention. Both the Child Abuse Prevention Center and the Children's Bureau of Southern California co-lead the Strategies TA efforts. Strategies Technical Assistance supports county prevention planning teams in the development and implementation of comprehensive, evidence-based child abuse prevention plans. Our work is centered on strengthening families through a lens of equity and inclusion. Strategies Technical Assistance provides consulting services to county prevention planning teams and opportunities for statewide networking through events. Some of our past events have included webinars, statewide convenings, and learning exchange cohorts. We currently support over 30 counties in developing a comprehensive and collaborative child abuse prevention plan. What does prevention mean? Prevention strategies are sustainable, evidence-based practices and interventions that prevent child maltreatment. Comprehensive prevention plans address three levels of these strategies. Tertiary prevention strategies provide interventions for children experiencing maltreatment. Secondary strategies include programs targeted at families in need to alleviate identified problems and to prevent intervention. Primary strategies target an entire population in order to provide support and education before maltreatment occurs. County prevention planning teams are incorporating the social determinants of health into their comprehensive prevention plans. The social determinants of health are identified conditions in which people work, live, and play that contribute to health outcomes. These social determinants of health include education access and quality, healthcare and quality, neighborhood and built environment, social and community context, economic stability. As we improve these social determinants for communities, we help increase the health and wellness of their members. We also understand the connection between healthy, thriving families and the reduction of child maltreatment. Here are some examples of social determinants of health connected to primary prevention strategies. For education and access, programs such as general education development, parenting classes, universal preschool, and family resource centers all contribute to better education access. Healthcare and quality include health insurance, health education, and services in a timely manner. Neighborhood and built environment includes access to grocery stores, clean air initiatives, and community beautification. For economic stability, programs such as women, infant, and children, housing vouchers, and subsidized childcare all contribute to economic stability. For social and community context, programs such as neighborhood events, school-based programming, and family resource centers all contribute to a more healthy community. The protective factors is a framework utilized by many child abuse prevention planning teams to guide the interventions offered in their communities. The protective factors are characteristics of families that act to mitigate risks and promote positive well-being and healthy development. These factors include concrete supports, social connections, social and emotional competence of children, knowledge of child development, parental resilience, and social and emotional competence of adults. When families demonstrate competence in these five areas, the chances of child abuse and neglect decrease, and the likelihood of developing a healthy and supportive environment for optimal child development emerges. The comprehensive prevention planning process provides a comprehensive plan that would design a system of child abuse prevention and overall community well-being. The plan will help design a system where families can get the help they need wherever they go, and also create a system where agencies are closely aligned and collaborative with their efforts. A timeline of comprehensive prevention planning. At the beginning of 2019, the California Office of Child Abuse Prevention hosted a prevention summit where 22 counties attended and began to think about how prevention could look in their systems and communities. On March 10th, 2022, the California Department of Social Services released an all county letter that defined the elements of the comprehensive prevention plan. Prevention teams began to develop their plans for prevention. What are components of the comprehensive prevention plan? The state defined the elements of the comprehensive prevention plan as follows: asset mapping and needs assessment, candidacy, population and services, theory of change or logic model, cross-sector collaboration, governance structure, tribal engagement, workforce training and development, continuous quality improvement, motto fidelity of evidence-based practices, child safety monitoring, integrated core practice model, spending plan, coordination with local mental health plans, sustainability, and assurances. For more information on these components of the Comprehensive Prevention Plan, please see the All County letter, which is linked in the description for this video. The Comprehensive Prevention Plan aims to serve the highest risk groups. These include Native American, American Indian children and their families, LGBTQ plus youth, children and families receiving voluntary or court-ordered services, youth with probation, children whose guardianship or adoption are at risk, children with a substantiated or inconclusive case of reported maltreatment, children with siblings in foster care, homeless or runaway youth, substance-exposed newborns, trafficked youth, children exposed to domestic violence, children whose caregivers suffer from substance abuse, and youth facing other serious risk factors. How will counties pay for this? For the first time ever, Family First provides opportunities to leverage federal funding as well as tap into other funding sources to enhance local prevention efforts. The Families First Transition Act provides one-time flexible federal funding to support Families First Prevention Services Act implementation and federally approved services. The state block grant, AB 153, State General Fund, will support counties in matching federal funding to create, build, and train a comprehensive, sustainable prevention infrastructure and continuum of services. ARPA, or the American Rescue Act Plan, Community-Based Child Abuse Prevention, CBCAP. This is one-time funding for planning and providing primary and secondary prevention activities and services. Child-based child abuse prevention grants is also available to provide child abuse prevention services. Thank you for joining the statewide effort to eliminate child abuse and neglect. To become more involved, consider the following questions. What is my purpose, goal, or role in joining this effort? What experience and knowledge do I bring to the table? What do I need more information about? Who else must be involved in this effort? Do you want to learn more? Contact the California Department of Social Services at FFPSA Prevention Services at dss.ca.gov. For comprehensive prevention planning support and trainings, please see www.caltrin.org. And for more information about Strategies Technical Assistance, please see www.strategiesca.org.